Hello you guys, and welcome back to the Salon Beauty Doctor here on YouTube. And in today's video, we have a very special guest. We have the acne expert herself. We're going to be talking about some in-office acne treatments that you can get to help manage your acne. If you've reached the point where, some of the over-the-counter topical treatments and your regular skincare regimen is just not cutting it, it's just not getting to it, we're going to be talking about some of the treatments that you can do, and we're going to talk about price as well, because I know that is super important when it comes to wanting to know, like, is this going to be for me or not? So keep watching.
First of all, I'm hearing an accent.
Yes, I'm from Haiti. I'm Haitian.
Okay, because I'm hearing a Caribbean accent. Caribbean recognizes Caribbean.
Really? Where? Which island?
I was born on the island of New York, but my mother and father and my family are from Trinidad.
Oh my God, I love Trinidad. Oh, yes. I have a great friend from Trinidad. Oh,
nice.
I love the food. I love the people are so nice.
Yes.
I love that. Yeah, and you're in New York. You're surrounded by islanders.
By everybody. Well, all of the people them they hear. So I wanted to talk to you about some of the most common types of acne, because not all acne is created equal. And sometimes I think people might think they have one thing when it's really another. So what are some common types of acne?
So I'll just go into the knowledge, but there are 4 grades of acne and 2 types of acne. So the grades are so it's grade 1 to grade 4. So grade 1 is very mild. Your whitehead and blackheads, blackheads on the nose, that's still a form of acne, right? And then we have grade 2, which is actually the most challenging, although it's grade 2. This is where you have tiny little grains of sand under the skin. They never come to the surface. They don't come to a head. You hear that term? And it's you have to get them extracted. And that type of acne is very challenging and require a lot of exfoliation. And this is the type of acne where it gets worse before it gets better, because it has to come to the surface to heal. And then we have grade 3, which is your papules and pustules, lots of whiteheads and inflammation. And then grade 4 is cystic, huge cystic acne. And then we have 2 types of acne. They're inflamed or non-inflamed. And those grades fall under those, right? So it's either, can you see the inflammation on your face? Then that's inflammation. Can you see pus? Can you see it's raised? That's inflamed. And non-inflamed, you can't even see it, right? You're covered, your makeup covers it well. So that's your whitehead and blackhead, right? So inflamed and non-inflamed. And inflamed is actually a lot easier to deal with, although it doesn't sound that way. But so we have 2. Inflamed and uninflamed. And adult acne falls under inflamed acne. So it's you wake up, you have a zit, and it's a whitehead, and you tend to pop it. So this is the most common type. And it's very easy to treat.
A question I have, and a question that I kind of see a lot, is how can someone tell if they have an allergic reaction to a product, or if it's something, because there are certain products that you use, like I mentioned before, when I had acne and I went to the dermatologist, they gave me a topical prescription treatment, and it felt like it was getting worse before it got better, and they call that the purge. How can you tell if there's what's an allergic reaction versus what is actually breakouts?
Exactly. And then with allergic reactions, sometimes your eyes will swell. And your skin will become very red, and sometimes there's some it itches as well. So if you're experiencing itching, redness, and swelling, that's definitely an allergic reaction, and you should stop it immediately. And then now there's the other side where you're experiencing peeling, right? And then you start to purge. So especially when I talk about grade 2 acne, when the sebum is stuck under the skin, right? And then it's stuck with dead skin cells, and we have to exfoliate those layers for it to come to the surface and heal. So if you're experiencing peeling and you can now see your cyst, the pimple, so that's called purging. And what happens is most people will just stop the treatment. And maybe it's with more, we need to educate people more on like, okay, you're about to use retin-A or benzoyl peroxide that you are going to purge. So I think like if doctors and estheticians, we educated our clients and customers, they would know what to expect and they wouldn't stop. So when you start to purge, it's like literally the light is coming.
Yeah.
Like there is hope. It's like, I tell my customers, don't stop. And because usually the cycle, it takes a good 3 months for your skin to heal, because this is the life cycle of a pimple. It's about 90 days from when it starts to form until it heals completely. So It's like so you just gotta hang in there. So that's the thing. And then most of us are not patient. We want results overnight. I want to put on the cream and I want to rush to the mirror in the morning. I was like, is my skin beautiful?
Right.
It doesn't work like that, unfortunately, with acne and hyperpigmentation. Yeah.
So at what point do people realize that, okay, I'm not going to be able to take care of this on my own? You know, I'm using the 2% salicylic acid, or I'm using a benzoyl peroxide treatment. I'm doing all the steps. At what point do people realize that, like, okay, I need to go to a professional? And then also, is there a case of acne that can be so, I don't want to use the word basic, but basic, that it's like, okay, go home and go get some Neutrogena?
You know, that's a good one. It's such a holistic approach. If you're breaking out and you've been breaking out forever, like for a year, right?
Mm-hmm.
And it's not going away, I think, I wouldn't even say a year, 6 months, and it will not stop. Go see a professional, whether it's a dermatologist or an esthetician. So if you pass the 3-month mark, then it's like, okay, this is not going away, because this is usually the life cycle of a pimple. I would recommend going to see a professional or a dermatologist, right?
Okay.
Because then it just keeps getting worse. And then and then we can talk about diet too. So it could be something.
Yeah, we're going to have a whole video on
that.
Diet. You guys make sure you tune in for that one.
Because that's a whole discussion in itself. So, and then, this is why it's good to go see a professional. Maybe you're using the wrong skincare, the ingredients. Maybe there's myrostol in there, sodium lauryl sulfate, carrageenan, all of these. And then you're just keep breaking out to where you can just use better skincare, and a professional can help you figure that out.
With that. Yeah.
Exactly.
And just so you guys know, I have a post on Instagram where I talk about the differences between an esthetician and a dermatologist, because that's something that a lot of people were asking me. And I was like, let me make a post, put it right out there so you can kind of understand what the difference between the two are. So you mentioned that there's the life cycle of the pimples, about 3 months. And if you're trying, everything in 6 months, you're not really seeing any results, it's time to come in to see a professional. What are some of the typical treatments that people go through for acne? And because people on YouTube, they want to know the pricing, as much pricing as you can talk about, because I know pricing is going to vary from place to place, and how many treatments you're going to need and the type of treatment. But if you can get like an overall kind of number.
Yes. So when looking at acne, I don't treat. So at the office, we only treat acne, right? And I know for acne, we're going to need to use infrared and blue light, right? We're going to need to use that. We're going to need to use disinfectant in our treatment. We're going to need to use oxygen. So these 3 things definitely, and lots of mandelic acid when it comes to acne. I do not recommend, and listen really well, I do not recommend if you have active acne to go and get micro needling or microdermabrasion. I see that mistake being made all the time, or dermaplaning, because what you're doing is, because acne is a bacteria. So what you're doing is you're taking the roller with the needles and you're rolling the bacteria all over the face. So I notice people they'll have breakouts in their forehead and now they're covered in acne. So those treatments are not suited for acne prone skin. So if you have acne prone skin, make sure you're getting you can get a vitamin C treatment, oxygen infusion, lots of infrared LED light, blue light. Those are really, really good treatments for acne. And then if they're going to do a mask, make sure it is oil-free. And sulfur is also a good treatment. We use tons of sulfur in our in-office treatment as well. And then as far as prices, it varies. In California, it varies from $75 all the way up to $275. So it depends on where you are.
And is that per session, or is that like overall?
It's per session. So some places are could be $75 per session, and some places are $100, $150, $200, $250. So it depends. So if you're in Beverly Hills, it's a little more pricey. On the west side, it's a little more pricey. And then if you just go out in the outskirts, then it's a little less expensive. But that's the big variation I've seen in prices here in California.
Yeah. Okay. So I had a couple of questions about the different types of in-office treatment. So one, you mentioned blue light.
Yes.
Wait, you said blue light, right? Because red light is anti-aging, right? Okay. I was like, wait, blue is acne, red.
Yes.
So what does blue light therapy entail?
It does. It kills acne bacteria. So that's why we love to use it for acne. It really helps to kill the acne bacteria. That's what it does. And at the office, we like to use infrared, not just red, but infrared, because it has an anti-inflammatory component to it. So I love to mix both in order to just not only kill the acne bacteria, but to reduce inflammation, because acne is really inflammation. So those are the difference. So if you go somewhere and they only have blue light, that's great. But if they have infrared, you can ask for that as well. So it's great to combine the two.
Yeah. How many sessions does it usually take with the blue light to start seeing results?
I would say 6 sessions, but again, you got to do other things at home.
Yeah.
Great skincare. You got to watch your diet, your lifestyle. There's so much more. So if you have acne, what you're eating does affect, your acne, and we're going to discuss that. So if you're doing all of this at home and you're going in to get your treatment, I usually see huge difference by the 6. Some people by the 4th treatment, but 4 to 6 treatment, definitely.
And blue light, the price range, is it the same price range you mentioned before?
We include it in our treatment. So some places will just make it an add-on. So you can pay, I don't know, $20, $40 more. Our prices are inclusive, because I just feel like I don't want to just tease you and be like, oh, but we have this blue light here too. So I just make it like we give everything, the vitamin C treatment, the oxygen. We do all of it for one price, so that you don't have to guess, right?
Gotcha.
That way. Yeah. But if you go somewhere and it's an add-on, please add it.
Yeah. So the blue light is an add-on in addition to another regimen of treatments that people would get at the office.
Yeah, at my office, it's included. We don't do add-ons. So if you're coming for an acne treatment, just so you're getting the mandelic enzyme, you're getting the blue and red light, you're getting the oxygen, you're getting the disinfectant, you're getting the hydration. So we do everything in just one. So because I just feel like it's a lot better rather than having to choose what to pick. And then we know what your skin needs. It's like, this is the treatment. Yeah.
So, okay. So I just want to make sure that, I'm understanding correctly. So someone comes in, they're like, I'm at the 6-month mark, nothing's working. I've got lots of both inflammatory and non-inflammatory breakouts. help me, please. I need a treatment. What is the person is going to get an acne treatment, and then those are inclusive of the mandelic acid, the blue light. I think I have a great analogy here. So if you go to the hairstylist to get your hair done, you're getting it washed, deep conditioned, trimmed, and styled. So that's like an analogy for what happens when you go to get your acne treated.
Yes. Correct.
Okay.
Correct. Exactly. And then different places have their own, their own menu on how they want to put it all together. But for us, we like to just put it all, like you're getting the blue light, you're getting the mandelic enzyme, you're getting the oxygen therapy. So we do that for each treatment, and you just pay one price.
Oh, okay. So over a course of like, say, 4 to 6 treatments, it can wind up costing like what, $2,000?
So $800.
Oh, okay.
Yeah.
I mean, not that $800 is like okay kind of thing for everybody. But I feel sometimes when people hear, esthetician or dermatologist treatment, it just, I don't know, I guess people maybe think about like plastic surgery and those kind of costs. Right. So to me, it seems within reach, but it may be outside of that reach for some people, but it's not so far out that it seems like impossible.
It is not. And I just feel like if it's something of value to you, if you feel like, if it's really bothering you and it's going to bring you relief and boost your self-confidence, like you really don't mind.
You really want to do it. Yeah.
You really, really want to do it.
And then what kind of maintenance do people need to do after they're done with these treatments? Is there anything special that they need to do?
So the thing about acne, once acne prone, always acne prone. So you have to manage your acne. So this is why we take a holistic approach. You still got to watch your diet, your lifestyle, your makeup. We talk about makeup, all the makeup that are triggers, we eliminate them, and then you just got to follow. Like if we say no dairy, like literally no dairy. So I had some dairy this week and I broke out on my forehead because just know sometimes my skin is just beautiful, and then I'm like, let me dip my toe, and then I'm reminded very quickly that I'm very acne prone. So it becomes a lifestyle. It's a lifestyle. Okay. So we have customers who've been using our products for like 6 years, and they just like, nope, I'm just using this cleanser, this moisturizer, and this serum because it is made for acne prone skin. I know I'm not going to break out, and I'm going to continue to follow the diet. It's like, just like when you go on a diet and you lose 20 pounds and you just got to keep going to the gym to exercise. So it's the same thing. So you may not use as much products as you were in the beginning, but you just gotta make sure that you're using the right cleanser, the right serum, and the right moisturizer, and an acne treatment. Yeah.
All right, this is awesome. And like I said before, guys, we are going to have another video where we're going to talk about diet. So make sure you are subscribed and you're ringing that notification bell so you get your notification so you don't miss it. And make sure you follow Marie-Claire at Acne Expert on Instagram.
That's right.
I just love Marie-Claire. Like, once we are able to move freely about the country and I go to Los Angeles, I'm gonna have to have a kiki with her at lunch or something because I just love her. And if you are in the Los Angeles area or going to be in the Los Angeles area and would like more information about the treatments that she offers, if you want to make an appointment, if you want to check out her skincare line, I will have all of her information in the description box, so make sure you check it out. We're also going to have another video on diet and as it pertains to acne. So you know you want to see that. So make sure you are subscribed to this channel and you have your notifications on so you don't miss that video. Follow me on social. The links will be in the description box. And I will see you fine folks, you and you and you and you in my next video. Bye guys.